Jackson, are you diabetic?
Not.
I'm afraid these numbers indicate differently. Your blood sugar's at 350.
No, there's no way I have diabetes.
Baby, listen to the doctor.
If I have diabetes, they won't deploy me. That's it, I'm done. And I can't be a soldier anymore. You understand.
Well, it's true you don't have the classic risk factors. Obesity, family history, and your white blood count is elevated, so it's possible there's some underlying infection driving your blood glucose up.
Okay.
We'll run some more tests, see if that's the case.
Please.
It's my patient, Captain Jackson. He's a physically fit, active service Army Ranger, but his blood sugars indicate he has diabetes.
You run labs, do a CT?
His pancreas is healthy. There are no sign of tumors. His labs came back clear for infection and autoimmune disease. Can't find a reason for his diabetes, but I did find this. He fractured 2 thoracic vertebrae.
Ouch.
Exactly, so why hasn't he said anything?
Why do you think he hasn't said anything?
Overseas, I saw a number of soldiers who were away from home a lot. They were depressed.
Depressed patients tend to mask or hide pain.
Right, but the thing is, diabetes is a red flag for the military. You test positive, you don't go back to combat.
So if you're depressed about overseas deployment,
You think he might be happy to have diabetes. He's home for good, but that's not the case. Jackson's extremely upset at the possibility of not going back to active service. Something's going on with him.
let's go say hello to Captain Jackson.
This is Dr. Charles. He's a senior attending physician here. I've asked him to consult just to make sure we're covering all our bases.
Yes, sir.
Please, as you were. You're Mrs. Jackson?
Yes.
It's nice to meet you. I just wanted to make sure that I have your history straight. So, you've seen combat before.
Yes, sir.
And this was your first tour?
7th.
7th. And
What was in the test results?
You have a couple fractured vertebrae that will heal on their own, but all your other tests failed to give us an answer. We can't find a clinical reason for your high sugars.
Clinical? What does that mean?
a physical cause.
I'm sorry, what kind of doctor are you?
He's a psychiatrist.
A shrink. I don't need a shrink. I'm not crazy.
Nobody's saying that you are.
Honey, they're just trying to help you.
How is a shrink gonna help me?
As I said, we're covering all our bases.
You think I'm faking this?
No, you can't fake blood sugar.
So what are you saying? Huh? You think I did something to myself? You think I'm a coward?
Not for a second is anybody saying you. Whoa, Mr. Jackson.
I'm out of here.
Hey, Mr.
Whoa,
Mr. Jackson.
The captain has been gaining weight, seems to bruise easily.
It's totally consistent.
I just can't believe it.
Let me do this. Mrs. Jackson,
I'm sorry, I don't want these to get cold.
I won't keep you long. In reviewing your husband's symptoms, I'm pretty sure I know what's causing his diabetes. And I think you do too.
What? What are you talking about?
You don't lie a whole lot, do you? I mean, you're certainly not very good at it. To your great credit. To lie well, you have to loosen up, make eye contact, stuff like that.
I don't understand what you're saying. I mean, lie about what?
Somebody's got to go in there and tell your husband the truth. I could do it. Let me hold those for you. Afraid I've got some bad news.
Oh, please, I'm having a terrible day.
About to get